Breast cancer remains the most common cancer in women worldwide. But the numbers tell a deeper story. In this video, we'll explore how breast cancer rates have changed from the 1990s to today, both in the US and globally. We'll also break down survival trends, racial and demographic disparities, and why some groups face higher risk and worse outcomes. By the end, you'll understand how breast cancer and survival changed over time, which populations are most affected and why, the role of health disparities, access to care, and bias in all outcomes. Let's go ahead. In the United States, breast cancer incidence rose from the 1980s into the early 1990s, partly due to widespread adoption of mammography screening. After a slight dip in the early 2000s, incidence has stabilized, with about 297,790 cases of invasive breast cancer projected in U.S. women in 2023. The lifetime risk is now about 1 in 8 women. Mortality tells a more hopeful story. Since 1990, breast cancer death rates in the U.S. have declined by about 43%, thanks to earlier detection and better treatments. However, declines have slowed in recent years. Globally, breast cancer is now the most common diagnosed cancer worldwide, surpassing lung cancer in 2020. According to the World Health Organization, there are about 2.3 million new cases and 685,000 deaths worldwide in 2020. High-income countries have higher incidence, but also higher survival due to access to screening and treatment. In contrast, many low and middle-income countries see lower incidence but higher mortality because cancer is diagnosed later and treatment is less available. In the US, breast cancer incidence differs by race and ethnicity. White women have the highest incidence overall, but Black women are more likely to die from breast cancer. In fact, Black women under 50 have a 40% higher mortality rate compared to white women. One major factor: tumor biology. Triple-negative breast cancer, which is more aggressive and harder to treat, is about twice as common in Black women compared to white women. Access to early screening, quality treatment, and systemic healthcare inequalities also play a large role. Other groups at risk include women of Ashkenazi Jew descent due to BRCA1 and 2 mutations, and women of higher socioeconomic groups who may have more reproductive risk factors but also better access to care. The good news is survival has steadily improved. Today, the 5-year relative survival rate for breast cancer in the US is about above 90%, and for localized disease, it's up to 99%. But survival is not equal across all demographics. Delayed diagnosis, differences in treatment, access, and implicit bias in healthcare contribute to worse outcomes for minorities and underserved populations. So, what do these statistics teach us? Breast cancer survival is a success story overall, but disparities remind us there's work to be done improving access to early screening. Reducing healthcare bias and tailoring treatment to diverse populations are critical steps. Understanding the numbers helps us to push for equity so that progress in breast cancer benefits everyone, not just some. If you guys liked the video, please click the like and subscribe button. And if you guys have any questions, comments, please type it in the chat, and I'll see you guys next time. And go ahead and check out the video above.